So my name is Lonnie Hessen. I'm an occupational therapist and a clinic director here at KidSpace. And I've been practicing for 11 years, and I've been in private practice for the last 5 years, or 6 actually. So we work with children who have sensory processing disorder. We work with children with autism spectrum disorder. We work with kids that have different kinds of learning needs. We have kids with attention deficit diagnoses, and some kids that don't necessarily have a diagnosis but are just having difficulty with their occupational performance across. Absolutely, okay. Definitely. We have kids with gross motor delay, kids who have praxis and motor planning issues for sure that go along with their their diagnosis of maybe autism, or maybe go hand in hand with sensory processing differences. We started working with Gyro Wheel after your lovely folks came and spoke with us about your product, and I guess that was in the spring of this
your son year. Tried it out, right?
Right, and my 6-year-old, who was he was 5 at the time and was absolutely not willing to get back on his bike with training wheels, but also not willing to take the training wheels off, tried it and was riding his bike within a week, and we took Gyro Wheel off and it was great. Okay. And we're using it with a couple different types of kids. Again, kind of the kids that just have sort of that low core, and kids that are not really strong in the core and have low muscle tone. Really great for them because they just need that extra stability to feel confident enough that they can keep their balance on a bike. And kids, again, with that motor planning and praxis issue, so difficulty with, maybe planning, the steering and the pedaling at the same time. That's been really helpful because then the balance component is completely, eliminated, so they can really just focus on the pedaling and really focus on the steering. And then, it's also great for kids who have limited language abilities, maybe kids who have autism, because then you don't actually have to explain so much. You can just motor through the activity without having to give verbal directions. You can visually show them that the bike will stay upright, which is really great. So that's great, if you've got a kid who just really needs that visual component of seeing that, you're not going to fall down, but you can't really explain that with words. That's a really nice feature. The kids that are sort of the kids with maybe the core and low tone tend to pick it up really pretty quickly if the motor planning piece is intact, just because, all the kids that have sort of the low tone and, maybe the core weakness tend to be the kids that just aren't really confident enough to kind of feel like they'll be able to do it, and once their confidence is up, then you can completely, be independent. But I'd say that the kids who have, the greater praxis and motor planning problems, it takes a little bit longer. And it also I think the kids really like the wheel, so they are maybe less willing to take it off as quickly. And they're like, no, this is my magic wheel, I'm keeping it forever. We've had anywhere from a week to maybe a month at this point. I don't feel like we have a huge collection of data yet. But when you learn to ride a bicycle, you have so much, it's such a huge emotional thing for kids to be able to ride a bike. So aside from, the physical benefits of being, bike riding being a great thing for bilateral coordination, a great thing for balance, a great thing for, vestibular processing and visual processing, it's huge when kids can ride a bike and they feel like, oh my gosh, I mastered this incredible skill. It emotionally is just fabulous for kids to be able to do that and have that freedom. When Peter, who's my son, learned because of Gyro Wheel to ride his bike, we were actually at a party for 4th of July with my whole family, and it was a big block party, so everyone was on a bike and riding up and down the block. And he came over to me once he really felt like he had it mastered. He came over to me and he said, Mommy, now I can ride my bike wherever I want to go.
That's awesome.
So, right? I mean, he was like, okay, I can now go 6 blocks away from you. When I said it's a huge emotional boost, of course it's because, it's so common to see other kids and families riding their bikes together. And when you can be a part of that, that's great.
Cool.
For sure. You have to do the magic trick where the bike stands up by itself. You have to show kids that. They're amazed by that, and when they see that, they're like sold 100%. They want to get on it.
They can do it.
It was definitely, for Peter, it was the magic wheel, and it, had super special powers. So just be playful with it, I think. My best tip is to, be playful and be excited about it. Probably, I'm definitely not with the kids for every outing on the bike.
Sure.
Yeah, I mean, they're gonna get it more quickly if they're, practicing with their parents. Yeah, more so kind of introducing the bike, and introducing, how to do it, and then, maybe monitoring a session or two, kind of figuring out if they're, the parent is trained well enough to be able to, use the bike safely and that kind of thing, which most parents, it's pretty easy.
Yeah.
We were really excited to be able to use the product, and again, for both personal and professional, just was a big step for my own son, and it really definitely is a big step for kids, and we love using it.
Cool. My name's Stacy Nens, and I am a pediatric physical therapist. I've been a physical therapist for about 11 and a half years now. I own a pediatric practice that has physical and occupational therapy called Starfish Therapies, and I've had that practice about 4.5 years now. And then before that, I've worked in other various settings with kids and with adults.
Right.
With the Gyrobike, we've used it with the kids that are at the age where their peers are starting to ride bikes and they're not quite there yet. So I've used it with kids with developmental coordination disorder, hypotonia for no reason at all. They just have low tone, so generalized low strength also. Kids with Down syndrome, dyspraxias, which falls under similar to developmental coordination disorder. Tends to be the kids that are a little bit weaker, maybe a little bit clumsy, have trouble coordinating their movements, or just don't have the strength to balance. They're having a harder time getting. What I'll usually do is I kind of have a bike progression. The biggest thing is, can they pedal? So we have adapted tricycles also. So depending on the needs of the child when they first start out, we may put them in an adapted tricycle, which has, because what that allows is the continuous pedal motion. So if they get started, the pedals kind of help them along. We will also use just a typical tricycle, and so I'll start with them pedaling a tricycle. And once they kind of master that, usually they're a little bit too big for the tricycle by that point.
Right.
And then we'll jump over to, we have a 12-inch bike with training wheels, just because that's what we have, although some of the kids have their own 16-inch ones with training wheels. And we'll go to that, and I want to get them so that they can pedal with enough cadence so that they can maintain propulsion of the bike. I found that actually that's one of the biggest things that helps, is if they can keep enough speed going, they can have a better job of maintaining their balance on a bike. And so once they've started to independently pedal the two-wheeler with training wheels, because then I can actually, because what I'm doing is I'm focusing on the pedaling, and that's why I like the training wheels for that aspect, is it gives me time to help them with that coordination and getting that continuous movement. So once that starts to click, I will pretty quickly switch them over to the bike with the driver wheel. And the other thing that I really like is that it gives them just that little bit, it gives them a chance, they have a delayed reaction sometimes. So because the bike, if it's already moving, it waits a little bit before it starts to fall. It slows the off balance off, so it gives the child time for their body to register it and kick it in. Because some of the kids, they have trouble registering when they're going off balance, and so then by the time they realize, it's too late. Or they realize, but by the time their brain tells their body what to do or coordinates the muscles to do it, it's too late.
Right.
And they get better with that with practice, but by being able to slow that loss of balance down, or I can let go a little bit easier and they'll stay within a general range, and if they start to go, they'll have time to start to recognize, and then I can see if they're going to kick it in or not.
Right.
But it gives their body a chance to react, as opposed to me just holding on tightly.
Right.
And so what I can do, because it does have that the Ghost Rider effect, I can start to open my hand a little bit more with them, so that I can start to get one revolution maybe, or a half a revolution, and then, and then sometimes it's a few more, and then it's funny because sometimes it takes repetition, and it's usually just me working with them on it, so maybe 15, 20 minutes once a week.
Yeah.
And they've kicked in, the longest it's taken is maybe 2 months, and that's not doing it consistently.
Okay.
And before all of a sudden it just like you see it click, and they're like, oh, I can ride it. And so I always start on the like most stable setting. And then I've played around with taking it down to the less stable settings, or just kind of cold turkey, and I've gone back and forth. Like, I'll kind of do both. Once they get it, I'll take it down to a less stable setting, but then I'll also let them go on their bike, on another bike without the gyro wheel, because all of a sudden they have a lot more give, and so I want them to kind of have both chances to react. Depending on the kid, a lot of times it's like keep pedaling, because they think I'm just going to push them along.
Right.
So if I can make sure that their feet are pedaling, and then what happens is if your line of vision changes, the steering wheel goes, your balance goes. So in the beginning, a lot of times I'll have a visual target. So like, okay, we're pedaling to the white car, or we're pedaling to the gate down there. So I'm trying to pay attention to, are they pedaling? And then I'll be like, look at the gate, head to the gate, head to the car, whatever it is, so that helps them to keep their line of vision, which will then aid with their steering. If their peers are riding bikes, they're at an age where they're starting to notice if their peers are doing things that they're not. And so, I've actually, not kids that I've worked with, but I've heard other parents talk about like, oh, they really want to learn how to ride a two-wheeler, but they're just either, afraid to do it, or they're just not getting it. And it's, and the kids want to, but then they also don't want to do it because they don't want to not succeed. And so, at least with me, it gives them a chance for some success, and they can start to get it down. So now they're like, look, I'm riding a bike like my friend is. Can I go bike riding with my friends soon?
Yeah.
And so I think it's like the self, on that side, it's like the self-esteem and doing what your peers are doing. On the other side, it's just great exercise. Besides just the cardiovascular and the exercise benefit, they're working on their balance, they're working on coordination, hand-eye coordination, reciprocal movement, so one foot after another, doing different things, which carries over to walking, running, all those things, challenging the left and right side of the brain, and it's fun, so they're exercising and not even realizing it.
Right. So do you see that it has improvements in other physical activity areas for them once they've learned how to ride? It kind of all works together?
I think it all works together. We do a lot of bike riding, especially with kids that, are learning to walk. Like I said, we have an adapted tricycle, so I think the benefits of bike riding for even kids with more involved needs are that they are having to do something continuous, right, left, so that'll carry over into walking. So a lot of times I'll ride a bike with a kid, and then we'll go work on another task that involves the coordination or the reciprocal movement and things like that.
Gotcha.
So I do see a carryover. We're big fans of bikes in our practice, one, like I said, because it's age appropriate, it's fun, it's exercise, and it involves a lot of coordination, which carry over into almost every task.